for another episode of the Medigap Show. I'm Holly Cohen, your host and founder of MedigapCares.org, an agency dedicated to help you understand your Medicare options across the country. Today's topic is what to do about Medicare if you are working past 65. There's a lot of misinformation floating around out there. So you're going to want to watch this video until the end and take good notes so that you don't make any mistakes in this critical time for your Medicare enrollment. When do I have to apply for Medicare if I'm still working? You can apply for Medicare even if you're still working. If you're 65 years or older, you're eligible for Medicare and you have a 7-month initial enrollment period, IEP. This period starts 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after your birthday month. During this time, you can enroll in both Medicare Part A, the hospital insurance, and Part B, medical insurance. There are factors, however, that may determine if you should take your Part B. If you or your spouse are still working and offered group health insurance. Many people choose to delay enrolling in Medicare Part B while still working, and you're allowed to. Part B comes with a monthly premium. This year, in 2023, that premium is $164.90 a month. If you already have employer-based health insurance, you may decide to hold off on your Part B enrollment, and you do not have to take it if you or your spouse are still working, offered health insurance through your group health insurance, and your group is more than 20 employees. Now, let's talk about the importance of timely enrollment. If you don't sign up for Medicare when you're first eligible and don't have any other coverage based on current employment, as I just discussed, you may pay a late enrollment penalty when you do enroll. So enrolling on time is crucial to avoid any additional costs. If you're already receiving your Social Security benefits when you turn 65, you will be automatically enrolled in Part A and Part B. However, if you're not receiving Social Security, you can apply for Medicare, both A and B, or just Part A. Online, it's available on the Social Security website or by calling Social Security or visiting your local Social Security office. Let's address the cost aspect of Medicare while you're still working. If you've worked at least 10 years, that's 40 quarters, while paying your Medicare taxes, you would qualify for premium-free Medicare Part A, the hospital. However, keep in mind, Part B comes with a monthly premium, and its cost varies based on your yearly income. It can range as low as $164.90 per month to as high as $560.50 per month in 2023, depending on your income. Now let's discuss the critical considerations when deciding whether to enroll in Medicare while still working. If you have employer-based health insurance or your spouse does and you're allowed to be on it, it is essential to compare its costs and benefits to Medicare. So if you work for a company that has fewer than 20 employees, you do have to take your Medicare Part B, no matter what, which means that you should not really have that group insurance and your A and B, because it's going to cost you more money than having original Medicare Part A and B and a Medigap plan, like a Plan G or a Plan N, or you could do Medicare Advantage. But typically, to combine or to coordinate your group insurance, if you have less than 20 employees, and your Part A and Part B, doesn't make a lot of sense because it will cost you too much monthly. Here's another scenario for you. If you are still working, or if your spouse is still working, and if you are offered group health insurance through either your own employment or your spouse's employment, because Medicare Part B is going to cost you a minimum of $164.90 per month, it is best to consider how much your monthly premium is on your work plan or your spouse's work plan that you are on. How much is your portion of that monthly premium? Also, another factor to consider is what is the max out-of-pocket cost on that group health insurance plan. Another factor to consider is how is your health. So these factors all need to be considered. It's best to speak with a licensed agent to go through this. Licensed agents are experienced. We do talk to people every single day that are in your situation, and we're always here to help you at medigapcares.org. Take your specific Medicare scenario, help you understand it, and then help you make the best decision for yourself based on your options. That wraps up our explanation of applying for Medicare while still working. Remember, making the right decisions about your health care is very important, and we're here to help. If you have more questions or you need personalized advice, don't hesitate to comment down below or reach out to our team at Medigap Cares. And of course, if you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more Medicare insight. Until next time, take care and stay healthy and make informed choices about your Medicare options. Bye for now and be well.